Dr. Antonucci, most dentists, when they talk about gum disease, which is an awful thing, kind of, but it's not recognized by us people as an awful thing until it is awful. So anyway, most dentists, when they talk about gum disease, they talk about the danger of losing your teeth. And while I agree that this is a big danger, and it's not a good thing, and it costs a lot of money, the fact still exists that you dentists do a phenomenal job putting in implants and all kinds of things, and even if you need what's called bone grafting, building, in the end, you can make this whole thing looking pretty good. After all, we're not in the time where I think it was George Washington who apparently had a wooden tooth. You know, that must have been awful. So you're doing a good job at it. It looks to me, however, that while this is happening, 1 year, 2 years, 5 years, whatever it takes till all hell, breaks loose, the person poisoned his body. You have an infection. You have that ugly yellow red pus in your mouth, which I think is the gateway to the blood vessels. I mean, just go and take a little bit of salt or whatever it is under your tongue, and it goes into your blood like that. So wouldn't that yellow, ugly infection, wouldn't that go into your blood, poison your liver, poison your kidney, poison your heart, poison your brain, and all kinds of other things? And wouldn't that be much more irreversible than fixing the teeth in the end? I mean, tell me, yes, no?
Well, yes. I mean, you said many things, but the answer is yes. You have an infection in your mouth. The mouth is really the portal to your entire body. Your mouth, as you said, absorbs everything. You put a medicine under your tongue and it's absorbed immediately throughout your body. And because there's so much blood supply there. The mouth is the only place in our body where there's an opening from the outside to the inside around the teeth. There's no skin that's actually sealed around the teeth. It's just a connection. Right. So when you have an infection there, it can spread very rapidly and has effects. There have been many studies showing that there's a connection between heart disease, between all sorts of heart ailments and periodontal disease. That people who have gum disease have higher incidence of having heart attacks and strokes and many other conditions. And it makes sense because when there's an overload of bacteria in your mouth, they work their way into your body very, very quickly.
So I've heard that even there's a tremendous amount of pregnant women who have premature babies when the baby is underweight. Is that true? The cause of gum disease, linked to gum disease, very heavy.
There are statistical links to that. It's strongly believed that that's the case. I don't know if we know for 100% that that's true, but there are statistical links that show low birth weight and gum disease go hand in hand.
Yeah, well, in fact, in California, there was a lady who had a stillborn baby, and they did say it was because they found gum disease infection in the placenta. You know, I mean, that's one case. And thanks God that those are extremes. But if those extremes can happen, wouldn't it be making sense that the next flu season, the next bird flu season, the next swine flu season, just the next flu season, which is for sure going to come, wouldn't affect the body? Because if all the, I don't know, call it health soldiers, if they have to go and fix that area in the gums, where else are they going to be helping you with the rest of the health problems which attack the body on a daily basis? Fatigue, not feeling so, I mean, it makes sense, right?
It makes sense to remove bacteria when there's too much of it anywhere in your body. And in your mouth, bacteria grow. And that's just the way that it is. Bacteria will grow around your teeth. You don't remove it, you're going to get sore gums. That's what gingivitis is. You don't remove that, you're going to get bone shrinking, which is what periodontal disease is. And the overload of bacteria is harmful. There's so many bacteria that exist that are very, very harmful, that live and reside in a person's mouth. It's literally disgusting when you look at it and analyze it and think about it. And if people truly understood what was there, I think they would pay more attention. As dentists, that's what we do. That's what we deal with. We're dealing with and trying to help each and every patient avoid serious problems by keeping their mouths healthy. And the only way to do that is if you have a gum problem, come in more frequently. At least come in twice a year. But people with gum problems, we see them, some patients, I see them once a month or every 2 months because their bodies can't override the infections that are occurring inside their mouth.
Right. Well, you said it, any infection in the body goes into the blood and it's just not a good thing. That's why they call it an infection. It infects everything else. So if a person has an ingrown toenail, he runs to the podiatrist. If he has like a small little thing on your hand, on your palm, on your chest, in your face, you run to the doctor. And how big is the infection in the mouth in there? It couldn't be very small. I mean, it's a pretty big area. And people don't go to the doctor. If the same infection would show up on their chest, they would probably run to a doctor right away, wouldn't they?
Well, the problem with gum disease is that it's so low grade, it's so unknown to the patient that it's easily ignored. One of the interesting things about gum disease is that it goes hand in hand with bad breath, with malodor, because the bacteria that cause gum disease cause foul breath. And there's basically 3 different types of smells that'll come out of the mouth. But when they're there, they're very distinct. You can tell without being a dentist when a person has gum disease just by the odor that's coming out of their mouth. And dentists do focus on helping people's breath get better, basically by helping them deal with gum disease and gum problems. But patients are usually not aware that they have a gum problem. If they link it to malodor in the mouth, to bad breath, maybe that would be something that would spur people forward more to realize that they have a problem in their mouth in terms of an infection, because that's many times what that's caused by also.
Right. So basically, you have bad breath, you have gum disease, you have an infection, your immune system is getting slaughtered. It's that simple.
Your immune system is affected, definitely. Definitely. And when this becomes a big problem is when a person's immune system is down for other reasons. If you get a flu and you have already an infection in your mouth, it will become much worse.
Right.
If you get sick, if you have diabetes, the problem is going to be much worse because your body is already having trouble fighting infections to start with. So people with diabetes have greater trouble with gum disease. If you're on different types of medications, that's taxing your body. It's making your body work harder or making your body more tired in terms of dealing with other things. Gum disease becomes worse, or problems in the mouth become exacerbated. And we often see problems arise in the mouth first because there's so much bacteria there to start with.
Right. Yeah, absolutely. Well, it's like, how many fights can you fight, I mean, how many fights can the United States fight and then still invite another one and another one before we run out of soldiers? And that's basically what you're saying here. Well, I hope that this video makes some people aware of that gum disease is much more than maybe just having bad breath, much more than losing teeth, all of it, which is pretty bad. But like your immune system gets slaughtered, you will be ruining other body parts, and that's just all there's to it. Your teeth and your mouth is not disconnected from the rest of your body. Thanks a lot, Dr. Antonucci. Thanks a lot.